What's going on, guys? We are back at it again with another episode, Convos with Dr. Andy. And today we're going to be talking about the sciatic nerve, not the sciatica nerve. Don't get it twisted, baby boy. We're going to dive into a handful of things about the sciatic nerve. And Andy, I kind of want to just cue you up. Man, why is this important? Why should people give a damn about this? And we can start there.
Yeah. What's up, James? So the sciatic nerve, why people should care about it. First off, it's the largest collection of nerves that come out of the lower part of the spine, right above your glutes or your butt, and goes down. It feeds all the primary muscles and tissues in the lower leg. And so it's a pretty big hunk of tissue that I think a lot of people claim to blame for a lot of their stuff, but and it definitely can cause issues for a lot of folks. But yeah, it's a large chunk of tissue that I think I want to clear up for a lot of folks as to what it is and where it is and how it presents itself symptomatically.
Okay. What's the biggest misconception about your sciatic nerve?
What is my biggest
No,
perception or
the
the
biggest
biggest
misconception.
misconception on it? Yeah, is that it causes everyone's pain everywhere, no matter what the pain is. If you have low back pain, sciatic. If you have pain in your butt, sciatic. Pain in the hip, sciatic. Numbness in the foot, automatically sciatic. Tightness in the hamstrings, sciatic. Can't go deeper to 90 degrees in a squat, your sciatic nerve. I think that there's just anything that pertains to the lower half, the sciatic nerve gets blamed.
Yeah, but why is that? Like, why is that the scapegoat for everything? Why is that, where you you drop everything off? And because it's a pretty common thing for people to say when you're coaching them in a CrossFit gym, in a clinical setting too. I mean, this is not
Mhm.
new. Why is that such a big scapegoat?
For one, I think social media, or at least the internet, has a big proponent to do that. You type in. I think I get a lot of patients that come in and type in low back pain into Google, or PubMed or whatever it is, and they get sciatica, coming across the main bar as like the top hits. So immediately they go to that. I think too, and I don't mean to call out any individual, but certainly, in the healthcare profession, physicians tend to, I think, hear low back pain or even just hear numbness or tingling or potentially weakness in the lower extremity, and they automatically go towards diagnosing it as sciatica without doing any proper orthopedic or diagnostic neurological exams. So I think people that gets spread around. Somebody, goes to a physician, gets diagnosed with sciatica just because they have low back pain, whether it is or not. This example, it's not. The doctor tells them they have sciatica. They talk about it with, their network of people, and someone else says, "Oh, I got low back pain too. It's probably my sciatica." And that kind of starts the wildfire of potentially people just assuming that it is one thing when it may not be.
Okay. How does somebody actually know though? Because people are going to a physician, an orthopedic, a PT, a chiro to have an understanding of what's going on with them. And a lot of them are not trained to understand the difference. So like how does someone know if it's diagnosed correctly as sciatica or if it's not sciatica?
Sure, there's a few tests. Simply put, a couple orthopedic exams could be a test such as the straight leg raise, where the patient's on their back and you raise one of their legs passively, meaning the physician does it without the help of the patient, and it can elicit a sharp reproduction of pain down the back of their leg that you could pretty much trace with a marker. So sciatic or sciatica, for instance, when it's truly impinged at the part of the spine where it comes out of the spine, called the nerve root, that's going to be a very specific pain going down the leg, particularly the hamstring, which is the back part of your thigh. Okay. It can stop anywhere from the glute, which is the bottom of your buttock, down to the top of your knee, all the way down to the calf, even bottom of the foot. And so most of the time, if somebody presents with that sharp radiating with numbness or tingling, weakness is pretty severe. That's usually a case that you would probably want to refer out right away if you're a chiropractor, as far as getting some further imaging. But if they come in with that sharp, they can trace it with a marker kind of sensation or numbness. That's usually a pretty sure telltale sign. Now, another thing is that it depends on where the the sciatic nerve is compressed. So if it's compressed to the spine, you'll automatically get those symptoms. If it's compressed by what's called the piriformis muscle, which is a deep muscle in your buttock, that's actually called piriformis syndrome. So it causes sciatica, the similar symptoms, but it's just a different area. So if you try to treat the spine where the sciatic nerve comes out, which will segue. So the sciatic nerve is the conjunction of nerves, which meaning a bunch of nerves come together, primarily between L2, sometimes L1, but L2, L3, which is your second and third lumbar vertebrae of your low back, all the way down to about S2, 3, and sometimes 4. So it's a pretty, that's 1, 2, 3, 4, 5, 6, potentially 7 spots in the spine where the nerve comes out and makes one giant nerve. But if that's not where the issue is, as far as the impingement on that nerve, and it's the piriformis muscle, and you're just treating the spine, then your route to achieve alleviation from that is going to be minimal because you're not addressing the actual cause. Okay. But yeah, so through orthopedic exams and neurological exams, you can diagnose, rule in or out sciatica. But the pain presentation typically has to be, they can trace the pain with a marker.
Got it. Okay, so you can trace it with a marker, and it's shooting, you said?
It can be shooting, so like very sharp. So, and it's usually constant. If you bring somebody's leg up in that straight leg raise exam, like I told you about, it's gonna stay constant because you're tugging at the inflammation and scar tissue that's on the sciatic nerve.
Okay, so it's not gonna be something that increases necessarily. Like once you feel it, like, ooh, here we go.
So that's gonna be dependent on the individual. So it can. Usually though, like when you're not going to be hanging out there, causing the patient, too much discomfort. Because once you get that sign and symptom, right, you don't need to hang out there and keep waiting for it to somehow get worse. Okay. But for the patient, if they're doing something, let's say hinging forward or performing a movement where you're irritating the sciatic nerve and they stay there, or they're repeatedly doing it, then yes, it will probably get worse because the inflammation is going to get more sensitive.
Got it. Okay. So if someone's in a position where they've been told that they have sciatica, they've been told that their sciatic nerve is what's causing these problems, but they've had no relief, like how does somebody do not a self-assessment to make sure that it's sciatica, but like how would you go about like an at-home treatment plan, and not even necessarily treatment clinically, but just for someone to do some self-release and what have you? Like, how can we make this actionable for people that are like, yo, my insurance doesn't cover me going to see another physician? Like, how do I start to remedy this on my own?
So I would say the easiest thing for people to do with that, which is actually an exam that I do in the office, is called the slump test. So, and it's called nerve flossing, or the technique is nerve flossing. So that's where you have a seat, whether it be on the edge of a couch, chair, bed, you name it, desk. And both feet are on the ground, and you tuck your chin down to your chest and you slump down as if horrible posture. Think about that. And then once you're there, if that elicits the pain, then in the low back where it elicits the sciatic pain that we described, that sharp traceable pain, then you don't have to go any further. If you don't get quite the response, you can kick one leg out, whatever leg is, let's say, you have right-legged sciatic pain, you would kick the right leg out. If you feel it, then you have a good idea of you're stretching the sciatic nerve and you're flossing it. So you're basically taking out scar tissue on the nerve. So that could be a diagnostic exam, but also a treatment. Okay. And you can do one leg, both legs, wherever whatever gives you the most discomfort. And what you'll do is you'll kind of go into that flexion mode, chin down to the chest, slump down, kick the leg out, and then come back, sit up straight so that you relieve the pain, and you go back and forth on that. And you're essentially flossing or scraping scar tissue on that. It won't feel good, but that can help kind of bring some ease and flow and fluidity and back into that tissue, into that nerve.
Okay. And if somebody gets a little bit more blood flow, if someone gets a little bit of relief there, I mean, when is it safe to say like, hey, you can resume normal activities, or you need to go see someone? Like, what are the indications that you need to take another step there?
Just like with anything else, it all depends. I mean, I don't think this is very common, but somebody who does that one time and gets immediate relief and never has an issue again, I would say they're good to go, right? They solved the issue. I think I give that treatment for patients at home, and it's just kind of even though you feel better, and some patients, get with adjusting as well, because I don't keep track, I don't keep notes on patients that don't come into the office, if that makes sense. So I don't know how good their home care is if they're not checking in with me coming to my office. But those that do that treatment protocol, I guess, at home, it's more of a maintenance thing. So even though they may not feel it, right? Hey, if it's feeling better, just do it less frequently, but just know that's in your back pocket. But as far as, getting back to regular activities, that's all you're going to be your best doctor in that sense of knowing that. So, the best analogy that I have for that is the literal, activity of flossing your teeth. The more frequent you do it, right, the less bleeding, the less sensitivity that your gums are going to have. But if you do it every once in a while, then you are probably going to, have some issues with that. So flossing wise, with the same thing with the sciatic nerve, the more frequent you do in the beginning, it's going to be uncomfortable. You're going to be ripping out stuff, making it sensitive, and then you have to do it less and less. But it's still there in your tool bag.
Beautiful. I hate flossing, both types. Anything you want to leave everyone with before we sign off on the sciatic nerve for today?
Yeah, I think just for clarification, I don't know if I covered this part of it earlier, but I know I mentioned that the sciatic nerve pain is very specific, where I said you can trace it. So just to differentiate, pain that kind of you can, generalize and say, it's over in this general area, say it be your glutes or hamstring, front of your thigh, shin and all that. If you can't trace it, but it's just kind of more of a dull, and you have to use your hand to figure out a generalized area, that's something completely different. So I just want to make that clear for people that sciatic nerve is very specific. Think S for specific, I guess. And then a very broad, can't really trace it, moves around a little bit more erroneously, then that's something different. So just wanted to clarify that.
Got it. So global pain, right? Global pain would be something other than sciatic nerve, something that would be considered localized or could take my thumb and run against it. That would be sciatic.
Yeah, like I said, the best thing that I was told, by somebody, and we even learned this in school as well, is I could literally trace it with a marker. However, vast an area that it covered, as far as like from my low back all the way down to my foot, they could literally draw it with a marker. Yeah.
Okay. Yeah. Solid, actionable. So, your marriage is not ruined because of the sciatic nerve. Your girlfriend's not cheating on you because of this. You're also not able to do a squat because of sciatic nerve. It is something that you've had a problem with your whole life. I would strongly encourage people to educate themselves a little bit on a little bit of parts of the body. But I think that with this explanation and the difference between localized and general, or local and global, I think that people should be better off than they came. So appreciate y'all's attention and very much appreciate y'all listening to this. We're going to sign off there on this episode. And if legitimately, this is not something that I probably said on other episodes, but if y'all want to hear about anything, you want to hear us talk about anything or unpack anything, or there's specific problems that you have, like, we're happy to do it. If you're on YouTube, you can just type it in the comments. If you're on social media anywhere, you can DM me anywhere. Andy will not respond to his social media, so don't DM him. But just hit me up literally anywhere: Facebook, Instagram, LinkedIn, TikTok, YouTube. You can just comments or DMs. Like, happy to dive into any conversation together. But we just got to know what you want. So I hope that was beneficial to everybody, and I hope everyone has a great day, man.